Good evening and welcome to tonight's live, where I'm going to be speaking to the lovely Dr. Lynn Burmeister, who is really an icon in the fertility field. She's been an obstetrician and fertility specialist for the past 20 years. She obtained a CREI, which is the highest level a fertility specialist can attain. And she's the proud owner of the beautiful #1 fertility, the boutique clinic in Melbourne. Now, lovely to see you coming through, lots of waves. Now, we always get a whole lot of questions at these lives, and I know I've had numerous questions emailed and DM'd to me already. So if you do have questions, pop them in now. If we do miss your questions, I apologize. Feel free to repost, and if we don't get to them, feel free to DM us and we'll make sure that we do answer those questions live for you. So just waiting for Lynn to join us through here. Lovely seeing some familiar faces there. Lovely to see you. Waves and highs. Looking forward to really digging into this topic, which I am so passionate about. I think there we go. View request. Excellent, coming through. So yeah, looking forward to it. Hi Lynn, how are you?
Hello, hi everyone.
Beautiful
Good
view
to
behind
see
you.
you.
Yes,
And
good to see
Melbourne
you.
behind.
It's been a
Beautiful Melbourne city.
stunning day here today. I'm so pleased. I've been out enjoying
I know, look at that. Parliament House.
Wow.
Isn't that gorgeous?
That is
tremendous. Look at that. We're so lucky to live in Melbourne.
We are. Well, especially now that we've done our job with COVID.
We're allowed to,
everything's looking good.
I know, we're coronavirus free. Well done, Melbourne.
We are. It's nice to see. And that's from your home, that beautiful view.
Yep. Just next to 1 Collins Street, so I can just walk. I'm so close to look at that beautiful view. How beautiful is Melbourne?
We are very lucky. And you are very lucky to live in such a gorgeous place, and your clinic.
I know, I'm so lucky. And I can walk across the gardens to collect everyone's eggs.
Now, I was just saying about your beautiful clinic here in Melbourne, and we're lucky enough to share some patients. I was going to say, I spoke to a patient this morning. I got emailed some baby photos of a patient from this morning for a shared patient, which is always so lovely to see. Now, your beautiful clinic, #1 fertility. For those who don't know about it, I'm sure everyone does, but tell us a little bit about your gorgeous clinic.
So what I've tried to do is make a clinic where it's not so it's not so medical, because we're not sick when we're trying to have a baby. We're just, 15% of the population can't have babies normally, but we're not sick people. We're not like we've got a cardiac problem or we've got a kidney problem. And to tell you the truth, people with medical problems shouldn't be treated like they're sick either. But we put our patients in these clinics where they're treated like they've got some terrible illness, but we're not sick. And my idea for the clinic and my vision for the clinic and my vision for fertility is to change the way people feel about infertility. And it's not embarrassing to be infertile. It happens, and you may need a bit of tweaking, you may need a bit of help. It may be something simple that you're just not having sex on the right day of ovulation, and it means that they need to come to people like you and me to be told, okay, well, actually you're missing the day that you're ovulating. And it can be something very, very simple. And so it's not an illness. So I set up my clinic to be like, when people come in, they don't feel like they're ill, and I want them to feel nurtured and make them feel very, very special in a beautiful environment.
And it's so lovely. I think it really bodes well. I love sending people into your clinic, and your team is amazing, the nurses you have around you. And it makes a difference to the whole experience and really the outcomes as well. I know I love the study that showed that women who were entertained by a medical clown post-transfer had better pregnancy outcomes. It's just, sending those beautiful positive neurotransmitters. And I know your transfer clinic at the beautiful Emerald City is really a lovely to be.
Yeah, so we have Emerald City set up purpose built for Embryo Transfer Day, and so we have pre-COVID, but now we're starting to do it again. We have beautiful lounges that women can lay in pre and post transfer with their partners beside them, and we know that the studies don't say you have to lie down after your transfer, but it's how you're treated pre and post transfer. It's a very, very special day to have that embryo transfer put back, that little embryo that may be your baby is going to be put back in you on the day. It shouldn't be in and out, whatever. Hopefully it works. Good luck. It should be a very special day. And if that embryo transfer works, that's going to be one of the most memorable days of that baby's life. So we try and make it very special. And so one of my transfer nurses, Nurse Jen, she always sprinkles the baby dust before we go into the embryo transfer room, and we've got 2 rooms, Amethyst and Ruby, and one of our patients has named her baby Ruby because she conceived in no one's named their baby Amethyst yet. I'm waiting for that. But one of our patients has sent me a little note saying that she named her baby Ruby. And we just try and make the day really, really special and make it a positive, happy experience rather than a sad medical experience.
And I know Jen does a lovely job of that. It's so wonderful to see as your team is amazing. And I know she gives out a checklist that I've got, Your Fertile Pantry checklist. And a few patients have emailed me saying, thank you so much. It was so great to see Jen. She gave me these tips of things to do. It's just such a great experience. And I can see these questions flying through. And I do have a few already for you, Lynn. So we're going to start firing these. So just wanting to ask, I've taken Clomid for 4 rounds and 2 rounds of letrozole, no pregnancy. Should I keep on going with letrozole? That's probably a common question.
No, probably not. So I think what you need to do if you've done 6 cycles, it depends why you've been put on it. If you've been put on it for a ovulation disorder, then at this point you need to have your tubes checked. And your partner's sperm. There's so many people that come to me and they haven't even had their partner's sperm checked.
Yeah.
So no. Yeah. So check your partner's sperm, make sure, and check for sperm antibodies. There was someone that I saw earlier this year that was about to start IVF, and the sperm antibodies hadn't been checked for. Now, if they had started IVF, he was covered in sperm antibodies, his sperm, the sperm wouldn't have got into the egg. So have a good sperm test, have an antibody test. But if you've been on 6 cycles of ovulation therapy, make sure the ovulation therapy is first working. Have you had your progesterone level checked? Have you had an ultrasound to see if you've got a follicle? So do all those basic things. I hope that the doctor that has been prescribing that medicine has actually been looking at all those things. But after 6 cycles, you need to have a tube test, or you may need to do IVF. Maybe, and that's what I say to patients. You've got 2 pathways. There's left and right. One pathway could be going down the tube test and continuing further ovulation induction, or one pathway could be IVF. And so that's where that patient is right now. So, and also looking at lifestyle factors. So I'm a big believer in healthy lifestyle. If you can't give me a good egg or a good sperm, no matter what sort of lab I've got, whether I've got the state of the art of everything, I can't really make a good embryo out of that egg and sperm. I need to have healthy eggs and sperm, and then out of the healthy eggs and sperm, our lab is going to make a healthy embryo.
Yeah, I do. That's why I love working with you. I love creating the healthy egg and sperm for people and helping them with that, and then passing them over to your beautiful technology. And that's a great question. Get the investigations, because I've had a patient recently came to me and both their vitamin D levels were 20. And
wow.
I like to see them at 100. They were really low. So again, both going into IVF cycles. So we've gone, whoa, hold off. Let's just get these things sorted before we go back in. So,
and we know vitamin D is so important. Like, I don't think it should be called vitamin D. Vitamin D should be called a hormone.
It is. It has been said that. Yep. Should be called a pro-hormone, they think now.
Yeah. So one of my fertility friends who lives in Saudi Arabia, he's an IVF doctor in Saudi Arabia, because women cover themselves up, he said that there's a huge infertility problem because their vitamin D is so low. So they can't get pregnant because they actually stop ovulating because their vitamin D is so low. So, so get your vitamin D checked and get it up to around 100.
Yeah, so getting a basic screen is always great, whether you're doing letrozole or whoever you're with, or even if you're trying naturally, getting your B12, folate, vitamin D, all the basic checks that I know your patients always have done to check what's, because you don't see symptoms. And I have had, unfortunately, people go to their GP who said, oh, you don't need any tests, you don't have any deficiency symptoms. Vitamin D, you don't show any apart from subfertility and poor bone health, which you don't feel or see. So it really is important, vitamin D, particularly in lockdown that we have been. So supplement wise, I've got a question. What such supplements do I stop after transfer? I guess it depends on what you're probably taking. If you want to clarify.
I usually tell patients like to stay on everything, and then when they're pregnant, we'll wean them off the things that we think they don't need. So remember, we've got that whole 90 days, which is our talk is tonight.
Yeah.
90 days to make a baby. So I usually tell patients to stay on everything, and if you're pregnant, great, and then we'll tell you what to come off. But that first 10 days of whatever you and I are prescribing is not going to harm the baby.
Yeah.
So stay on everything while you're trying to conceive, because if you stop and start, then it doesn't work. So if your IVF cycle doesn't work, and let's face it, we know that when you have an embryo transfer, it's most likely, unfortunately, not going to work. Let's be honest. And so if you stop and start all your medicines, then the effect of your medicine is not going to work. So I usually say stay on everything until you've got your positive pregnancy. And then when you've got your positive pregnancy, we'll talk about which ones to come off.
And make sure you are seeing someone, like Lynn and myself, who can prescribe the right supplements to you, because I have seen people come to me who are taking some herbs that perhaps shouldn't be taken around that time or with their medication. So make sure that you are seeing someone like myself or a fertility naturopath who works with specialists and knows what to take through a cycle. That's really important. We don't want to, Lynn's doing an amazing job with the meds and getting your levels right. You don't want to be taking anything that may impact that. So do make sure that you're seeing someone who's expert in infertility and can give you the right supplements. But yeah, in general, all the stuff that we recommend all the way through, and then we can talk about that afterwards. So
someone asked a question about coffee. What do you think about coffee?
Look, what I say to my patients is it's not good for fertility. It does cross the placenta when you're pregnant, and there is studies that pretty much anything that's close to zero, you get better pregnancy outcomes. In saying that, I've had people who are generally having 4 coffees a day, and we've got them down to 1. I'm like, okay, I'm okay with that, and you can have that 1. So as close to zero as you can get is better. There was a recent study came out recently that said it's pretty much zero if you can. But yeah, whatever your baseline is. So I've had people come to me who've been taking, 3 Coke Zeros a day, and if we can wean that down and just get them onto a cup of tea, then that'd be great. But
yeah, someone just asked what about tea, and then what about decaffeinated coffee? Because I think all the stuff that they use to decaffeinate the coffee is probably not good for patients as well.
You want to be looking for a Swiss water decaf if you're going to go for decaf. Don't get a regular off the shelf in the supermarket decaf, because it may use chemicals, as you said, to decaffeinate the coffee. So Swiss water decaf if you're going to do it. Otherwise, a turmeric latte, chai latte, matcha tea. There's so many other varieties available that don't contain the caffeine. So if we can slowly wean you down that caffeine, just because it's stimulating as well, it's not great for your adrenals. There's a lot of other reasons why we'd want to be reducing it. And when you fall pregnant, you're going to want to be stopping your coffee. So let's act as if you're pregnant, because you really are, as we're talking about today, the 90 days, you're already nourishing your future baby. And in my opinion, in some ways it's more important during these particular 90 days, because you're creating a blueprint on which your baby is going to be built, basically. So if you can create this great blueprint, then you're going to create a healthy baby. Once you've fallen pregnant, it's kind of set in stone. We're going to nourish it and do the best we can, but you've got this great opportunity in these 90 days, which is why we love coming on and talking about it, to optimize that blueprint that your baby is going to be built upon, and that's going to set them up for life. So,
and we know that we know that from our generations, we're even affected from what our generations have put into their bodies. We know that from epigenetics. So whatever you're putting into your body now will affect the health of your baby. I had a patient the other day who was making some really bad quality embryos, and she made 3 embryos, but they're all very bad quality. And again, like, why am I not pregnant, doctor? I can't believe I'm not pregnant, doctor. I've spent all this money. I'm not pregnant, doctor. And I said, oh, I looked through the history. Is your husband still smoking? She goes, yes, my husband's still smoking. And it's like, well, your embryos are probably fragmented and not good quality because your husband's still smoking. Like, so many men are still smoking and they're trying to have babies. So you need to get your fellas off the cigarettes.
Absolutely. And get them healthy. I know I do find it hard with men. They often think that their sperm is a DNA vehicle, that they pass on the DNA, and once they've, got them pregnant, then that's their job done. But I did a great podcast. If you want to go to my website, on the podcast tab, with Associate Professor Adam Watkins. And I often refer my husbands to his podcast, because then it's not me telling them, it's just someone else telling them. And his research is showing that it's not only getting you pregnant that the sperm does, it affects the lifelong health of your future child. It affects the development of the placenta, the development of the pregnancy. So yeah, it's really, really important. So we don't just want swimmers. I tell my males, I want Olympic athletes. We want the best. Do you want the best for your baby? Do you want to create the best blueprint? Well, then smoking, you really. And women, I smoke not as many, but I read a study recently that it equates to 10 years added on to your fertility life. So it's basically like a 30-year-old becoming a 40-year-old, or 40-year-old becoming a 50-year-old if you're a smoker. So
so it's very important not to, and I think that's the message to get out to younger people in their 20s, that you've got to look after your eggs when you're in your 30s. So, and things like vaping. So one of my patients works for the Cancer Council, and she's trying to get the message out that vaping is not good, but she doesn't know how to do it. And I said, well, maybe we could do something on vaping and sperm quality and egg health, because vaping can't be good for you. It's just another form of smoking, but it's supposedly the healthy form, but it can't be good. But we don't have studies yet to prove to the community that it's not good. But vaping with all those chemicals cannot be good. And there's already evidence that it causes these popcorn lungs, where pockets of air is left in your lungs after you vape. So things like vaping, like, even though you might think it's a healthier version of smoking, is not a healthy version.
And unfortunately, there's some of these simple changes. A lot of people aren't actually aware. And look, a lot of the men, in all fairness, aren't aware of how much their smoking is impacting their fertility. So again, vaping, there may not be that awareness. So it's, a lot of people, there's a patient that I'm seeing at the moment through to labour, which is great. She came from your clinic, and she'd have 7 failed rounds prior to seeing us. So I worked with her for 3 months, went in to see you. I'm now supporting her towards labour. And she's 42, but it's like, I didn't know this earlier. Why isn't this information available? The simple changes that we were able to make to get her pregnant at 42, when she was started trying at 35.
Yes.
And so many failed cycles. So yeah, hopefully this sort of information can get out further. Now, hello, lovely ladies. Yeah, does too much vitamin B6 and B12 affect egg quality?
I think I spoke to her earlier today. I went into work and I spoke to her, say hello, special hello. I'm not going to mention her name, but yeah, she asked me today. So her vitamin B6 was quite high, and I think that's okay to have a high vitamin B6. I don't think it affects your egg or your sperm quality, but she was getting some sensory, saying that her hands were a bit numb sometimes. So I've told her to stop taking the multivitamin, just take folinic acid and ifolic for a while to clear out the vitamin B6. But I think if you're taking a multivitamin, and we measured our blood, most of us would be high in our vitamin B6. So I don't think it's harmful. In fact, it's probably good for our nervous system, but it can, I think some people can develop symptoms if they're on it for a very long time.
You don't want to be taking too much vitamin B6, and you certainly want to dominate it too high. In relation to vitamin B12, I actually like it high. I want it above the reference range pretty much. Now, studies are now showing that the reference range should change, really. I like to see my patients around 500, which is, I think 700 is the top of the range, and I prefer to see you above the range. So vitamin B12, quite the opposite. You want to have plenty of that. B6, up the higher end is fine. It depends what your levels are. And again, get them checked, speak to someone who can help you with that and work out why they're high as well. If it's a simple supplement and we can just remove that, then that's great.
Yeah, and it might not be everyone as well. It might be some people, have symptoms if they've got the high vitamin B, and other people have no symptoms. I take vitamin B every day and I feel fine. So I haven't had my
Absolutely.
levels checked, but I have a lot of vitamin B every day. In fact, I take your vitamin every day, Tasha.
Oh, excellent. Yes. If anyone's, I think I know a few people are
Yeah,
on
I
that. So
take it every day
yes,
and I'm not trying to get pregnant.
I take it every day too because I know what's in it. And so
Yeah,
that's got, yeah, your folinic
it's on
acid,
my
your
desk.
folic, good vitamin B6, methylated B12, so all the good nutrients to be absorbed into your system. So that's Zycia nutrients. If anyone hasn't taken it, Zycia, you can find it at zycia.com.au or in Slade's pharmacies, which is now next to Lynn's clinic, or Great Earth Health stores and local pharmacies. But yeah, you got to get on a good prenatal multivitamin. It's I saw a post on Insta the other day, which is really important. It's not just about the vitamins being in the tablet. That's all well and good for it to be listed on the packet, but is it being absorbed and metabolized into your bloodstream and utilized by your cells? And that's what we want to see happening. We don't want to just see high levels in your blood, and that can actually be misleading. That's why I don't just look at folate, because if you're taking a folate supplement and it's not being well absorbed into your system, your blood levels will be high, but you're not getting it to where it needs to be. So it's really important to take a multivitamin that has well absorbed nutrients that get to where they need to be.
So Maxie's just asked a question about natural killer cells. She's put in a
Yep.
lot of PGS normal embryos,
Yep.
but hasn't had her natural killer cells tested.
Yep.
So that's a bit of a worry when patients are putting in lots of normal embryos that they're not implanting. So yes, your doctor does need to look for implantation failure. So things that might cause implantation failure, one of the big things is a hydrosalpinge that can be actually missed on a basic ultrasound. So if you've been putting in PGS normal embryos and you haven't had a laparoscopy, then I'd highly recommend that your gynecologist or your IVF specialist does a laparoscopy on you to look to see if you've got endometriosis, hydrosalpinges, and also look into the uterine cavity to see if the uterine cavity is normal, because sometimes there might be something wrong with the uterine cavity, like a little fibroid or a polyp, and it's being missed on your ultrasound. So ultrasounds may not be 100% accurate. And so at this point, if you're putting a lot of embryos that are normal, then I think you need further investigation. So yes, natural killer cells could be part of that investigation, but also a laparoscopy. I think that's something definite. And if you go to Strictly You, where Sonia Kruger interviewed me, but I think I interviewed her, she actually says from her 6-year journey of infertility, no one had looked into her uterus. And I couldn't believe that when I was taking her history. And I said, well, first thing we're going to do, Sonia, is look into your uterus. And she believes that's the one thing that made her get pregnant. And I'm not telling, her story, because it's actually, she's put it on her website. But a hysteroscopy, a laparoscopy, particularly if you put in embryos that are not that are tested as normal, then definitely you need further investigations. And you need to
So
speak to your doctor about that.
important.
And if your doctor's not willing to do things like that, then you need to get a second opinion.
Yeah. Excellent. You've got to look at the whys. And I've just read online that you can't improve egg quality, only sperm, as they're always producing your sperm, but eggs, always have them. You can't improve egg quality. And I have been told that by a number of doctors, but we now know, and yes, you have had your eggs your entire life. You've had them since you're in your mother's womb. And that's why, as you were saying, Lynn, that, our fertility now and our preconception health affects 3 generations. And that's because our eggs were formed in our mother's womb. So when I talk to my new patients, I like to go right back to their mother's pregnancy and any complication. What was that like? Talk through their history, because yes, you had your eggs your entire life, but we now know that most of the chromosomal changes which determine the viability of your egg and how viable it's going to be are determined in the 90 days when those primordial follicles, which you've had your entire life, are developing into a mature egg ready for release at ovulation. So if we can optimize that environment, we now know it's not so much that you have old eggs as you age, it's the fact that your eggs are developing in an older body. So everything we're trying to achieve is trying to wind back the clock. So eggs need a whole lot of energy. So that's where things like coenzyme Q10, carnitines, really important to fuel that mitochondrial energy. So yes, lots you can do in the 90 days, which we're talking about today, to improve your chances of producing that quality egg, but of common misconception.
Yeah, exactly. But and I say to patients, yes, we're trying really hard to get your eggs as healthy as, but sometimes whatever we do may not reverse that aging process. And then some patients do need to revert to donor eggs if they get to an age where it's just not working. So we can only do so much, but again, if you can help yourself as much as possible and realize at the end, even if IVF or fertility treatment doesn't work for you, you've done everything you can possible to help yourself along that pathway, then I think it's worthwhile. And particularly we know that the egg cell starts, as you said, from 3 months, and from 3 months that I always tell patients, like, we don't know what happened 3 months ago. So it's like, oh, doctor, how come I only got 5 eggs this month, but I got 15 eggs last month? And I always say it's like a wave coming into land. You could have a ripple and you'll get 3 eggs, or you could have a big wave and we're going to get 20 eggs, or we could have a medium-sized wave and we'll get 10 eggs. So I would always refer to your eggs as a wave. So now you've got a wave that started 3 months ago. So what are we going to do to help that wave? And if we can do whatever we can from that very beginning of that egg's journey to help that wave, then we're going to have a better chance of getting you pregnant in the lab. So once we collect that egg, that's based on the wave that you've given us. So it could be 3 eggs, 15 eggs, 20 eggs. But that wave has been predetermined. No matter what medication we give you, yes, we can tweak it a little bit, but that wave is usually predetermined. And there's a lot of studies that actually show that most women don't need more medicine than 225 of whatever the doctor wants to choose. And it's more about the predetermined wave that's there. So if you give someone that's normal size, normal weight, 225 of whatever they're going to choose, you're still going to get the same number of eggs. So, it's that predetermined wave. And what we want to do is create the best wave that we can. So whether it's 3 eggs, 10 eggs, 20 eggs, you could get 20 eggs and they could all be rubbish, or you could get 3 eggs and they could be great, and the 3 eggs might end up in a baby. So you just need to try and improve that wave along the way. And we do know that the mitochondria increases in your body if you take supplements. It's actually been shown in journals and science that coenzyme Q10 and ubiquinol will increase the mitochondrial function of your egg. And we know that mitochondria is like the light bulb. It's like switching off. I'm having trouble with my phone now because it keeps switching off. So the mitochondria is the light bulb of your egg. So it's like switching the egg off and on. Now we know that ubiquinol and coenzyme helps improve the light bulb in your egg. That is the energy house of your egg. And that's been shown. So I think, and that's why I'm very, very big into supplements for my patients, because we see it in the lab. We see after the patients have been on these supplements, we actually see better quality embryos, whether it might be 1 egg that leads to 1 embryo. If it's a great blastocyst, I truly believe that it's because we've had our patients on the supplements for 3, 4, 5 months.
It's getting those healthy eggs. You're fueling that healthy mitochondria, makes all the difference through supplements and through diet. I'm talking about that in my Your Fertile Pantry course at the moment with my ladies. And it is about mitochondrial energy, which is coenzyme Q10, carnitines, fueling the energy, and also protein as well, getting the right quality protein, the right quality fats, carbohydrates, fueling, giving your body the building blocks, the right folates, getting it metabolized into your system. Vitamin B12, as I said, like to see on the higher level, they're all part of the building blocks of DNA. So we really want to have them all readily available, and minimizing toxins as well, because unfortunately BPAs and toxins are found swimming around our tiny little precious eggs. So minimizing toxins, so much we can do in those 90 days.
And I think also weight, if we can touch on weight, because a lot of my ladies are actually overweight at the moment. It's a very sensitive subject, and I think a lot of people have put on the COVID kilos, but I've noticed a lot of the ladies coming into the clinic are overweight. And I think that weight has a big impact on their egg quality and sperm quality. So a lot of the guys come in and they have put on a bit of weight, particularly over the last 6 months where they've probably been working from home and very sedentary. So I think if you can get out there now, it's coming up to the summer months in Melbourne, get out there and start exercising and trying to lose some of the COVID kilos, that's going to help the egg and sperm quality. We know that.
Yeah, absolutely. And get some support around that, because it's easier said than done. And it's more than calories in, calories out. You can often get insulin resistance, hormone imbalance, and look at your men as well. I have to say, they think they can get away with the COVID kilos more than we can. And no, it definitely affects their sperm health as well. So do it together.
Yeah, someone's just put up JM6998. Does the weight of men matter? Definitely, because what happens when men are overweight, their testicles overheat, and then that's where we get all the DNA fragmentation of the sperm. So when the sperm production is happening, if it's happening in a overheated environment, you'll get more sperm that has high DNA fragmentation. And then sperm with high DNA fragmentation is not going to create a good embryo.
Yeah, we need really healthy sperm, really healthy eggs. And I think it's important for women to realize too, just in the regards to human biology, is that not every egg that we release at ovulation, even when we're healthy in our 20s, is going to be viable necessarily. You know, the studies show that around a quarter of those weren't going to go on to create a baby. So as you said, if that wave, unfortunately, wasn't going to be a good wave, we can do everything we can to optimize that wave, obviously, but it doesn't mean that you can keep going, keep on your supplements, keep sticking with it, that we won't get a better wave next time. So
yeah, maybe next month. Yeah. And so do we have a weight restriction for IVF? And yes, we do. So most hospitals will have a weight limit for, you know, for where we're up to for egg. But like, you've got to ask yourself as well, if you're grossly overweight, you're not going to get pregnant. So what's the point in spending thousands of dollars on fertility treatment if you're grossly overweight? So yes, we do have weight restrictions, but again, why do you want to go and put yourself through an IVF clinic if you are grossly overweight? So you need to like do things about being overweight, like if you can't lose weight by exercise and diet, then, you know, you need to see a gastric doctor that can recommend banding or partial gastrectomy. So whatever, you know, but you need to do something about that being overweight, because yes, we can treat you, we can collect your eggs, but you may not get pregnant because the weight is affecting your eggs and the sperm. So the embryo that we get from you may not be very good.
And it's about the health of your future baby. And that's what we're talking about these 90 days. It's not just about getting you pregnant. You know, we're passionate about you having a healthy baby. And so invest this. In my personal opinion, this is the best investment you will ever make in your child's future health, is right now. Right now, before you've conceived, you're investing in losing weight, getting healthy, getting on some appropriate supplementation recommended for you, getting some guidance around really good preconception care in those 90 days. You are not only investing in getting pregnant, and if you are going through IVF, I guess making that hopefully a one-stop, you're pregnant shop, but also investing in the health of your future child and a healthy pregnancy. So it makes a whole lot of difference. So it's not just a weight restriction for the sake of it. It's the fact that we want you to be as healthy as possible. We want your baby to be as healthy as possible. So,
and someone's popped up a question, what about ubiquinol versus coenzyme Q10? I get asked that a lot as well.
Yes, so do I. They are the same thing, essentially. But yeah, ubiquinol is the better absorbed form of ubiquinone is the other form of CoQ10 that is available. Ubiquinol is more expensive, and I noticed a question popped up, how much should I take? I pretty much tell my patients, how much can your wallet afford? Because it's a super expensive supplement. And there are studies anywhere between 300 and 600 has been shown to improve fertility rates. So if you can afford even 150 or 300, great. If you can afford the 600, then, and again, when you look at how much it is, I think it, you know, equates to about $1 a day. You know, anyone, let's get rid of the latte that we're having that's negatively affecting your fertility. And we'll get you onto some good quality supplements that may cost you $3 a day tops. and are going to have a better impact on your fertility health.
Yeah, and someone's asked, what about bike riding? Does it affect my sperm health?
I mean, getting them, I know your opinion on that, but I have seen getting them hot in general is not always a good idea. Having them near laptops, getting them overheated. But again, it's all relative. Are they bike riding to lose weight? And yeah, wearing Lycra.
Yeah.
What's your opinion
It
on that,
depends
Lynn?
how much bike riding they do. I think if it's just a bike ride a day to and from work, it's fine. But I think it's probably those, 10-hour bike rides on the weekend probably affects the sperm quality. So I think an hour. And you've got to be careful with our gentlemen that come to the clinic, because if we put too much pressure on them, that they do get upset. So I think it's important not to put too much pressure on your gentlemen out there. So yeah.
And so, getting some help and support, seeing someone who can look at your case too and see how important some of these things are. I've had some of my women who are, bashing their husbands over, because of this, that, or the other. I'm like, you know what? That's okay. I'd rather you focus on this tiny bit. If we can get that fixed, then you can still have, maybe your beer on the weekend or something like that. And let's focus here instead. So it's, speak to someone who can tell you where to focus.
We certainly don't want to cause relationship issues.
So a few questions on ubiquinol there. Hopefully we've answered that. Yes, you can take them both if you want, ubiquinol and ubiquinone. Ubiquinone is a slightly less expensive version, so you can take them both. That's fine, between 300 and 600 milligrams. And I had a question back here. So there's quite a few. So if we haven't covered them, feel free to post again, because I'm scrolling back to see the ones I saw.
Is coenzyme Q10 good for men?
Yes. Yeah. It depends on looking at their sperm count and what's the issue for them. But in general, sperm need loads of energy. Fertilization needs loads of energy, lots of mitochondria. So yes, men should be taking ubiquinol as well. Great antioxidant and great for that old-fashioned Krebs cycle. We go back to year 12 biology, really fueling that energy.
And how do you support the lining of the uterus? We have so many patients with thin lining, and we've started doing platelet-rich plasma infusions, and it has actually improved many of the patients' lining. Not everyone, but it has improved many of the patients' lining. So what about from a natural perspective? How can we improve a lining? So a lot of ladies out there are suffering from thin lining.
Yeah, I did a great podcast. If you want to go to tashajennings.com.au and go to the podcast tab with Professor Gemma Evans, who spoke about the impact of diet on the uterine environment. So she's looking largely at receptivity of the uterus. So the things that mainly came out of her research is showing that you really want to avoid sugars. And unfortunately, soft drinks were the worst. So really avoiding soft drinks, particularly pretty much through the whole time, from bleed to transfer. You also want to be avoiding barbecued foods. So that, charcoalings are pretty much the Aussie barbecue of soft drink and burnt sausages. You really want to be getting rid of those around that transfer time, and any sort of aged foods. So we're talking sort of pickles and salamis and those sorts of things we want to be avoiding. The other thing we want to be doing is increasing blood flow. So I'll often speak with women. Again, I go right back to your mum's pregnancy and spend an hour with you working out what your specific issues are. I think I used to love detective shows, and I think I feel like I do that on another level now, and just really dig into what your issues are, because thin lining, there can be a few reasons for that. It can be hormonal. You might be exposed to toxins. It might be blood flow. So blood flow is really important. So looking at vitamin E and essential fatty acids are really important for that blood flow. Getting enough fluid. So literally helping with that, getting enough hydration. Are you getting 2 liters of filtered water a day, preferably not tap water, filtered water or spring water a day? Some herbs like ginkgo can be helpful. So speak to someone about herbs that are appropriate to use through your treatment. And also just functional things. Like, I love belly breathing. It might sound funny, but we don't get taught to breathe. We just pop out and we open our lungs, but most of the time we breathe really shallow through our lungs. We want to be breathing and opening our, really expanding our lungs, obviously is where the air needs to come in, but expanding our bellies. So breathing in through your nose, expanding your belly, taking the time to lower the blood pressure, increase circulation, and sending a nice strong message to your body too, because that this is an important area to focus on. Send blood flow here, because 90% of the time we're telling the body, send blood flow here, here, here. We're busy doing all this stuff. Let's go, hang on a minute. Let's focus here. Reproductive system. So yeah, those things are really important, but lots we can do for lining.
Yeah, so the uterus is like an organ. So the uterus is an organ. And so we know that people have, you know, bad hearts because they have bad blood flow to their heart. So the uterus is like that. So I think that people with thin lining probably have bad blood flow to their heart, to their uterus. So I think whatever we can do to improve the blood flow to the uterus will help their lining. And so I put a lot of my patients on vitamin E, which is a vasodilator, and sometimes I'll put them on Trental, which is an oral vasodilator. I know some doctors use Viagra. I haven't really had great, and it's very expensive. I haven't had great success with Viagra. So a lot of those things are experimental. So whatever you can do to try and increase your blood flow, and exercise is probably another one. You know, get out there and start exercising as well. I think that's going to help your lining as well.
And I love the exercise, the old-fashioned hula hoop and belly dancing, those sort of exercises that really get that blood flowing around the area, comparative to some Pilates and tightening. More just think of loosening and like Zumbas or, you know, hula hoops and things like that.
Someone's asked about acupuncture leading up to IVF, and there is a study that showed that I think it's about 10 sessions of acupuncture along that 90-day passageway can help improve the outcome and has a positive impact on pregnancy. So there are a lot of studies, a bit like, you know, is the natural killer cell true or not true? But I say to patients, as long as it's not harming you, then try it. So we know that acupuncture, there are some studies out there that say it may help, and there's studies out there that say it probably does nothing, but it doesn't harm you. So if it is going to help or possibly help, then why not do it?
Yeah, I love working with acupuncturists. It seems to make everything I do work better, which is always good. I've got a question about sperm morphology. What's good for sperm morphology? So with sperm morphology, you want to be looking at essential fatty acids. So the DHA, the heads of sperm are all rich in DHA. So you'll really want to be focusing on rich DHA sources. Also, you want to be looking at your folate and your B12 and your homocysteine, looking at your blood levels of those and getting adequate levels of those are probably key. And in general, your B vitamins. So and your antioxidants are always important to protect the sperm as they're developing. So looking at antioxidants, lots of colourful fruits and veg, good quality protein as well, because we need that. Good quality protein, good quality fruit and veg, and looking at coenzyme Q10, a good antioxidant, DHEA for that head of the sperm, which is really rich in DHEA, vitamin E and selenium are other which has been shown. I know you often give that in your supplement, Lynn. Vitamin E and selenium have been shown in studies to be supportive of that sperm morphology and sperm health.
And someone's asked if we have an acupuncture in our clinic. Well, if you've been to my clinic, I have 4 different rooms, and they're all named after flowers. And the design was meant to be so that patients could have pre and post acupuncture, pre-transfer, post-transfer, but because of COVID we haven't been able to do it, but we will be reintroducing it. So that's coming back shortly to our patients. Everything's just starting to wind up, and again, you know, we're so lucky in Australia to almost be down to 0 number of COVID cases, that we can recommence all these processes again.
It is nice that we're being able to open up and can do some face-to-face now. I had a question before that I was just thought through in regards to tea. Is chai tea, is that too sugary? I've had chai tea before. And yes, if you get the, I guess, pre-mixed version that has plenty of sugar and honey in it, that's going to be not great because you do want to be minimizing your sugar. So if you go for your regular chai tea, which I know I buy my chai tea from literally just the herbs, which is just the tea and all the bark and cinnamons to go with it, then that's going to be totally fine. So it is looking at your proper tea, not your chai blend, which is generally very sugary, because sugar you definitely want to, for weight, for all the things we've been talking about, for uterine receptivity, for weight, unfortunately. And I did another podcast with Associate Professor Louise Hull about sugar and fertility, if you want to pop over to her. And she was looking at the actual impact at a cellular level of sugar, looking at around, unfortunately, because it is found in the fluid, so it does have a detrimental effect. So getting some support around helping to minimize the sugar. I know you recommend inositol, which I do recommend to a lot of my patients who struggle with sugar cravings and might struggle to get them down. Getting some support around some supplementation and some magnesium that can actually help to minimize your craving for sugar. It's not just about, okay, you need to stop sugar. Let's stop your body craving sugar. And I know one of my patients said to me, what's in that? I don't actually feel like eating sugar anymore. And that's what
I know, it's amazing.
Yeah.
I noticed the other day my staff had some, like, a bag of, sugar out because we'd had a very busy day. So they had about, so maybe I need to pop some inositol into their water during the day so they stop having that craving. But you do get that craving for it. It's probably maybe we're not eating enough, like probably not having enough lunch or breakfast and things that gives you that craving for sugar.
Yeah, so it's having the regular meals, having some support around, when to eat as well, because having that, I think intermittent fasting is the wrong word for it, but not eating late at night, not eating too early in the morning, giving your body that rest overnight from food, eating the regular meals during the day, all helps to stabilize your blood sugar. And the inositol, I literally, with my patients, I get it in a powder form, and I do get them to put it in their drink bottle and drink it over the day, because you're getting that steady intake into your bloodstream to stabilize those blood sugar levels.
I'm going to tell all my girls at work to do that, because I noticed there was a big bag of lollies out there the other day, even though it said natural candy. I'm like, that's not natural candy, girls.
And I think that's the thing. I've just spoke to my Your Fertile Pantry program members at the moment about looking at food labels, because companies just want to sell product. And so they're going to say all sorts of things like natural and organic. It's really about looking at the back of the packet and seeing, is it actually healthy and what is actually in there, which is so important.
And someone's posted, like, does prednisolone and clexane help improve implantation? Well, again, that's one of the, the questions out there regarding fertility. And I think there's not any great studies that, have proven that they help or not. And that's what I say to my patients. I'll do a biopsy. And the reason why I do a biopsy before patients start IVF is, one, to check that I can get the catheter through their cervix, because I don't want to have your beautiful embryo and here's the big day, we've, put you in the growing room, we've made the big, baby dust moment, and then I've got the catheter and then I can't get your embryo into your uterus because you've got a tight cervix, you've got kinks in your cervix. So all of my patients will have a practice transfer before they start. The other thing we do when we do the practice transfer is we take a little biopsy of the lining and we scratch the lining. Now, there is a big study that's been released in the Cochrane Review that says scratching is rubbish and it doesn't help. But when you read that review, the scratches were done at all different times. So the scratches were done when people had their periods, the scratches were done a month before. So it wasn't really consistent data when you actually go into the nitty-gritty. And that's the problem with a lot of the IVF studies, that they haven't been done with consistency. And so it's not just a scratch. So I tell patients, it's not just a scratch, it's a practice transfer. It's a scratch, yes, but when you think about when you plant a seed in your backyard to grow a beautiful flower, you can't throw the seed on the soil. It's not going to implant. You have to scratch the soil. So yes, it is a scratch. And the other thing it is, we're going to send that tissue off for testing. So we're going to test, do you have an infection? Like, we've found people with infection in their lining. We've found people with overgrowth of candida in their lining, or actinomyces in their lining. So we've found overgrowth of things that will never allow an embryo to implant. So I think a scratch, if you want to call it a scratch, maybe we need to rename it uterine rejuvenation. Let's name it something else. Let's name it not. I think it's a vital part of your IVF process. And if you haven't had your endometrium checked and you're having repeated IVF failure, you need to ask your doctor to check your endometrium.
I love the inspection screen that you do in the scratch and the general screen, because infection plays such a huge role in being able to hold a pregnancy, being able to be receptive to a pregnancy. So really important that you're clear of any infections prior to going into a pregnancy.
And make sure that the lining is normal. I had a patient that had never had a biopsy of her uterus, and she had abnormal bleeding. And when I biopsied the uterus in the room, just a very simple procedure, it came back as endometrial cancer.
Wow.
So, and she'd been on IVF for 2 years. So, you know, unfortunately that poor lady had to have a hysterectomy. But, you know, in a way I saved her life. But how can you do IVF and not test someone's lining? I mean, that's ABC to me.
And it is to you, but make sure that, yes, you're listening to this and asking for these tests and getting the proper screens, because it is.
And I can't see everyone in Australia, and I can't see everyone in the world, but go back to your fertility doctor and ask them, why haven't you checked my lining?
Yeah. So really important to get a good screen, get a good workup prior to getting pregnant. Now, is there any healthy amount of alcohol that you can take in the 90 days prior to collection for both egg and sperm, or should you abstain entirely? Look, this is,
that's a hard question, because like we don't want our patients to be feeling like they can't have fun.
Yeah. And look, this is the hard part, and this is probably similar to the coffee discussion. As close to zero as we can get is great. But if you're having, you know, a glass of wine at a friend's birthday or a celebration, is that going to have a massive impact on your fertility? And I'll veto that by saying it depends on the person. So if I see someone who has an autoimmune issue or really has complications that we need to fix, this might be different advice. But in general, I always say to my men can get away with it a little bit more than women. And I would say less than 5 drinks a week, and that's never in one sitting. So it's not getting, you know, all of those 5 drinks on a Friday night. It's having them over the week, and preferably women keeping it to 1 to 2 a week, if that. And again, as close to zero as we can, because it's not good for our fertility health. We do know that. But if it's going to, don't let it affect your whole life. You may be trying to conceive for a long time. So sure.
Some people are probably, there's so many questions popping up. What about uterine candida? So that's a very hard one to treat and actually to diagnose as well.
And again, it's about getting the proper workup and the screens. A good question there: is fasting good for you? I mean, again, it depends on the person, but I do like, I guess, intermittent fasting in the way of eating it depends on the person, but I'll say either a 10-14 ratio or an 8-16 ratio. What I mean by that is eating in a 10-hour window and then having a break for a 14-hour window, because like I was saying before, our body is constantly during the day, it's fueling our brain, it's fueling our body, and digestion is actually quite a complex thing for our body to do. It needs to break down our food, metabolize our nutrients, so we can't be thinking about egg quality. So we don't want to be doing that overnight. So we don't want to eat right up until we were go to bed and then eat first thing in the morning. We want to give our body a break, and that's the way our DNA evolved. We're hunter-gatherers. We were not supposed to be eating at night because it was dark. We weren't supposed to be eating that late. So we're supposed to have that rest from about 7 or 8 o'clock at night until breakfast in the morning, and breakfast was something that we had to go seek for and get. So we're not supposed to eat immediately as we get up. And again, I work with my patients. You know, I have a patient who's a nurse, and her having to eat in the morning is really important. I'm like, well, let's bring dinner forward. Let's make sure we're getting that rest time, because quality sleep. And I talk through my evening fertility ritual with my patients, because sleep is so, so important, because it's the only time our body gets to focus on reproductive health. So fasting from that perspective, I do find beneficial. And there are studies on that, particularly for older eggs, that it's managed fasting. And I don't like the word fasting. It makes it sound like we're starving. You don't want to be starving. It's just making you eat, in a healthy window. And I think and if it helps you lose weight and get to the healthy weight, then that's going to help your eggs and sperm. And there's some great studies on weight loss in regards to intermittent fasting. So just for narrowing down that window and not eating late at night has huge benefits for weight loss. So that's one of the number one things I do first. And then we obviously look at diet and protein ratios and things like that for you as well. Yeah, Lynn, there's tons of questions coming through here. I know we're going to miss some, so I apologise in advance to everyone who's asked a question. We have missed. We are trying to.
We probably need to do another session because it's
I
coming up for
I
an
think
hour.
we do.
We're going to get an hour.
Right, it is too. We are coming up to the end, so I think we might have to pretty much call it a day. Sorry, ladies, and if there's more questions there, we will be back. We will come back and we will answer more questions. So thank you so much for joining me, Lynn. I really appreciate you taking the time out of your busy schedule.
Oh, pleasure.
Anyone wants to follow Lynn, you know, jump on her Insta. You have such great advice for ladies. If you want Zycia prenatal supplement, I know at Lynn's clinic they have some samples there. I'll make sure you have some more if you don't. At zycia.com.au. And if you'd like, jump on my Limster bio. I've got that checklist that I talked about that Jen gives out at the transfer. So Tasha Jennings.
Yeah, we love that.
Checklist. Yeah, I get great feedback.
Yeah, we love it. Empowering you with information. That's what we want. We want to empower all our ladies and all our men with information. And you should be able to ask questions. Ask questions. If it's not working, ask the question. Don't be scared to ask questions.
Yeah. I love hearing questions. There's no silly question, and make sure if you've got a niggling, you want that answered, then make sure you do. So
make sure you ask your fertility specialist.
Yes. Yeah. So thank you for joining me. I love your philosophy. I love what you're doing for the whole fertility industry as well as your individual patients. So thank you.
Thank you. Thank you.
All right.
Thank you, Tasha.
Bye.
Love you, love. Love you, everyone. Good luck.
Bye.